Child advocacy centers are working overtime trying to protect children during the pandemic, but there's only so much they can do. THV 11's Jordan Howington shows us how we can all help child advocates spot signs of abuse.
With the coronavirus pandemic comes isolation, and that isolation has proven an increase of alleged child abuse cases in Arkansas.
They feel like they're the only one.
When kids are taken into the Cooper Anthony Mercy Child Advocacy Center, they take a peek of this wall art, the painted hands reflecting those who've also suffered child abuse.
When you see them go and they get to put their handprint up and they're looking and seeing all the other children's handprints, you can almost see that light bulb go off, that they're not alone.
In May, 73 children have added their handprints to the wall, representing an increased number of cases during the COVID-19 pandemic.
We're seeing that surge, and at least we have in our counties.
When life around us began to shut down, including schools, churches, after-school programs, the number of child abuse cases took a drastic dip, not because they weren't happening. Instead, kids didn't have an outlet to turn to. Now that places are reopening, the number of abuse cases have increased. The CAC has learned they have about 20 more cases on their hands now than normal because of isolation.
It tells us that we know children don't need to be isolated. 94% of the time, children know or are in the home with their abusers.
Child advocates say while some COVID restrictions are still in place, it's important we keep a close eye on children, watching for potential abuse signs like sudden behavior change, withdrawals from activities and conversations, and learning regression.
That mechanism, that outlet in place for them to be able to speak out.
In Benton, Jordan Howington, THV 11 News.
The Cooper Anthony Mercy Child Advocacy Center has 3 locations in Central Arkansas and serves children in 6 different counties. If you suspect any child abuse, you can always contact the hotline 1-844-SAVE-A-CHILD.